Hey, it's Dr. DeCubellis here. I wanted to walk you through some of the things we talk about when we talk about degeneration, give you kind of some of the overview and basics of how it happens. And that way you have a better understanding of what we're talking about. And also, if you hear any of these things from either any of your primary care doctors, or if you come into our office and we talk about it, well, I'll give you an explanation. I'd like you to kind of know before what you're getting yourselves into. I know there's a little bit of glare here, but I moved it so it's probably out of the picture. So hopefully you can see this all right. But let's start at the top. Up here, we have normal. This is what we're looking for. Now, this is the neck. You can see up here, we have the jaw, and this is the head up here. Now, when we talk about that, we're looking for a nice slight curve, just like you see there. We want that because down here, we go to what's called phase one. Now, the difference between phase one and normal is we've completely lost that curve. The neck has gone straight. Now, this is important to understand because this is what leads to other issues. What happens is now because the neck has gone straight and we've lost this curve, it changes the biomechanics, movement patterns, and changes the way that these vertebra or the spine or the bones holds the weight of your head. The weight of your head is now moved forward because your spine has moved forward. When that happens, it causes more weight over the front part of these bones. Now, they're not made to carry weight there. It's supposed to be equally distributed over this bone. So when we have abnormal pressure over time, this is what leads to osteoarthritis or osteophytes or bone spurs. We start to get them forming on the front because what your body's doing is it's trying to increase bone growth to not only spread out the surface area to hold this weight that's there, but also stabilize the area because it becomes unstable when it's slanted like this. So eventually, what your body's going to do is say, hey, if you haven't gotten this corrected, I'm going to take care of this, and we're going to fuse these vertebrae together. As we move down here into phase two, we can start to see that. Because now what happens is not only the disc space has decreased and the bones are closer together, but the reason that happens is because due to this abnormal pressure we saw up here, the discs are slowly being killed off. That's degenerative disc disease. So degenerative disc disease means that we have a disc that has been degenerating due to abnormal pressure. So we see that here. We can also see we start to get some points forming on the ends of these bones. That's those osteophytes and osteoarthritis I talked about. Down here, it's gotten even worse. You can see now it's actually curving the wrong way. We've got some pretty large bone spurs and disc space are almost completely gone. So we don't want it to get down here. However, the question becomes, okay, well, if we start to have this, what do we do about it? Well, it's very, very easy. We want to get you back here. So how do we do that? Well, we've got to start restoring the normal functionality. You've got 3 ranges of motion. We need to get those back to normal. Joint motion is one of the most important ones. We have to retrain biomechanics and muscle memory. That way they'll stop pulling you and getting used to being like this, and they'll be trained to hold you like this. So we have to retrain biomechanics, muscle memory, movement patterns. We have to strengthen up tissue, but we have to make sure we do the right thing at the right time. Otherwise, you do the ton of strengthening, but you look like this, it'll speed you along to get to here. And that unfortunately is what I see a lot of times. People have gone in, they started doing a bunch of neck exercises when they started to have neck pain, and it made this turn into this in a lot quicker. It's always better to get checked out sooner rather than later because the other problem is that as of the latest research, if there's an injury, if you're like this, we have an injury and something happens, you can go from down here to where we start getting osteoarthritis in as little as 6 months. So time is of the essence. But I hope that kind of explains a little bit more to you about what we're looking at, what we're talking about when we talk about degeneration, osteoarthritis, osteophytes, and degenerative disc disease.